Hi everyone, it is Yasmin here, and today I want to speak to you all about the topic of caffeine during pregnancy. So many people can't get through their day without their caffeine fix. However, for pregnant women, it is an area that we need to be a bit more cautious about, as there have been shown to be some negative effects of high caffeine intakes for both mum and baby. So let's start looking at what caffeine actually is. So caffeine is a compound that is found within foods and drinks and other substances, mainly found in coffee, tea, so that's black tea, green tea, but also drinks like Coca-Cola, energy drinks, the well-loved chocolate, and also some cold and flu medications. It is a stimulant and will affect our nervous system by increasing our heart rate and increasing our alertness. However, the effects do vary from person to person, and this is generally due to differences in our genetics. Caffeine is quickly absorbed into the bloodstream after ingestion and is able to cross the placenta, so it is able to reach your growing baby. A study showed that after 200 milligrams of caffeine intake, the blood flow to the placenta was reduced by about 25%. Therefore, very high amounts of caffeine can be dangerous during pregnancy, but it is a very dose-dependent relationship, and we're going to chat more about that. So what are the risks that have been identified in pregnancy? So one of the risks, and all of these risks that I'm going to speak about, are to do with caffeine intakes of over 200 milligrams per day. So one of them was reduced fetal growth. So this was an observational study, but the study showed that there was reductions in birth weight related to caffeine intakes above about 200 milligrams a day. Miscarriage is another complication. So above 200 milligrams of caffeine a day could increase the risk of miscarriage, and some of the research has shown that the association was actually stronger amongst women who have no previous history of miscarriage. Caffeine is also able to narrow our blood vessels, which is called vasoconstriction, and this could lead to a narrowing of the veins and a reduced blood flow to the placenta, and therefore a reduced amount of oxygen available to the fetus. So that's something that we obviously want to avoid, to allow the baby to get as much nutrition and nutrients and oxygen from us as possible. Decreasing iron absorption is another risk. So iron is really important during pregnancy because we have increased amounts of blood, and we also need to be supplying baby with the iron as well. And caffeine, when taken at the same time as iron-rich foods, can actually decrease the absorption of that iron. So it is recommended to have, if you are having caffeinated drinks, to have them away from foods that are rich in iron. So the best way to do that is just to have, if you are going to have your coffee or your tea, just to have that away from meals rather than with your breakfast or with your snack. And finally, the systemic effects. So caffeine for mum may actually accentuate certain pregnancy symptoms such as nausea, heartburn, and trouble sleeping. So especially if your caffeine intake is in the afternoon or evening, that's going to have a knock-on effect on your ability to sleep, because the caffeine does stay in our system for, well, half of the caffeine can be in our system still 5 to 6 hours after you have consumed your caffeinated beverage. It is important to note that caffeine does contain some antioxidants that destroy free radicals produced in our body. However, the amounts that are available in the caffeine are going to be negligible compared to what we can get in fruits and vegetables and whole grains, for example. So during pregnancy, it's much preferred to get the antioxidants from the fruits and vegetables. So importantly, how much is too much? Now, recent research from a study published in 2020 revealed that the authors revealed that there was no safe amount of caffeine recommended during pregnancy. However, it is important to highlight that this study was mainly looking at observational studies performed over a period of previous years. So this means that the effects cannot be solely related to caffeine intake, because there were also other confounding variables in the studies that weren't controlled for, which are known to affect pregnancy, such as smoking, stress, and diet. So all of those things weren't controlled for. So we cannot attribute those findings solely to the caffeine. Therefore, I'm going to present the current UK guidelines in terms of caffeine and pregnancy. So there are variations in the amount of caffeine that certain drinks and foods will contain. However, it is generally recommended to limit your caffeine intake to under 200 milligrams a day, as most of the research has shown the increased risks of intakes above 200 milligrams. So you might be thinking, well, what does that mean in terms of tea and coffee, for example? So an average mug or brewed cup, so about 230 millilitres of coffee, can contain about 100 milligrams of caffeine. However, this will depend on where you're getting your coffee from, the quality of the coffee beans, and actually sometimes the same amount, so a brewed mug of coffee could contain as much as 170 milligrams of caffeine. So again, it's very hard to put a definitive limit on how much is too much, but generally a typical cup of tea can contain between 25 and 50 milligrams of caffeine. So tea does have a lot less caffeine in it than coffee does. So just to summarise, my advice for pregnant women would be to don't start taking up caffeinated beverages during pregnancy if you're not a habitual tea or coffee drinker. So it's not going to be the best time to start drinking caffeine, even if the tiredness and the exhaustion starts to kick in. Just try and manage it in other ways if possible. Be aware that switching to decaf tea and coffee still contains about 15 to 30% of the caffeinated counterpart. So yes, it will reduce your caffeine intake, but it doesn't completely cut it out. Opting for herbal teas and things like chicory as a drink is a much better alternative. Generally, it is advised to limit your caffeine intake or your coffee intake to 1 cup of coffee or 2 cups of tea maximum per day. And please remember that there are still caffeine in things like we said, chocolate, which a lot of pregnant women tend to crave during pregnancy. And if you are at all concerned about your caffeine intake, please consult your GP or your nutritionist. I hope that has been helpful, and I'll speak to you soon.